Hello, everybody. I'm joined by Carole Hallam, an independent nurse consultant in infection prevention. As we're all aware, under these COVID circumstances, there's a lot of confusion as to what is best practice, what should and shouldn't be happening. So, Carole, what I've actually seen is a lot of people, seem to be sort of confused about wearing they should or shouldn't be wearing face masks in public. What's your view on that?
Thank you, Clive. That's an interesting question. And I think to be able to answer it, we just need a little bit of understanding about COVID-19. So, COVID-19 is one of the coronaviruses, and coronaviruses are a family of viruses that can cause diseases ranging from the common cold, we all experience the common cold, right through to MERS, which is the Middle East respiratory syndrome, and and SARS, which is the severe acute respiratory syndrome. We saw that in 2003, and I think COVID-19 is very similar to the SARS. So, and often referred to as SARS-2. So, to understand how it spreads, then we need to have that understanding if we're looking at what is the correct protective equipment. So, it's predominantly spread by droplet, and people say, well, what do you mean by droplet spread? So, droplet means as we speak, as we maybe sing or we're talking, we actually expel virus into the air on large droplet nuclei. So these are droplets that are larger than 5 microns, and so that means they're quite heavy, and they soon settle down onto surfaces, and then they become a contact transmission. So we pick them up on our hands, and then we can then transmit that to our eyes, nose, or mouth. So to get the COVID-19 infection, we need to either get contamination from a droplet that gets into our eyes, nose, or mouth, or we need to have contamination on our hands, and our hands go to our eyes, nose, or mouth. So to answer your interesting question about we see people in masks, should masks be worn or not? I think the answer there is in healthcare settings, there's a real need to be wearing face masks. In public, I would suggest that if we can do social distancing, then actually we don't need to wear a mask. There's real dangers of wearing a mask. So actually the risk is that people wear a mask, and this is in outside of healthcare settings. We see people wearing masks that are sort of under their nose, even under their chin. People are lifting the mask up, lifting them down. And as you can see, I put my hands where my mask would be, but actually near to my eyes, nose, and mouth. So therefore, my hands are more likely to be contaminated, and I'm actually taking my hands near to my face. So the risk that actually masks will cause more damage than good in public. So I think if we were wearing masks in public, we would need to really provide some education to the public about when to wear them, how to wear them, and really not forgetting that hands become contaminated. So I think there is a place for masks in public where, and it might be what the government recommend, that actually where we can't do social distancing. So for example, if you live in high-rise flats and you have to use the lift, you might not always be able to use that lift on your own, or if you're using public transport like the underground system in London, if that's your way to get to work as a key worker, then there might be a benefit there in wearing a mask.